Yeah, this is razor session. I always prefer my personal razor pointer. No. I prefer usually like this one. Okay. Actually, it's a lifesaver of me. My personal CV, and then yes, I've published the 2 books. The title is the razor therapy, and the razor acupuncture. Actually, both books is in translation book, English written into Korean book. I hope you remember the first razor acupuncture in 1973. Canadian Dr. Plog, he did the first application of razor acupuncture. He passed away 10 years ago. And I've published a paper related with that, the early history of razor acupuncture this year. And these pictures show that the razor acupuncture and razor moxibustion and other razor acupuncture. I'll show you a brief razor classification in medicine. Actually, in medical razor, it's divided into the surgical razor and non-surgical razors. One of the representatives of surgical razors is CO2 razor. It's can you see that the photodermal effect? So it's mainly used in dermatology, removing the wart, tattoo, and pimple, acne spot, and freckle, and wrinkle and scar by the coagulation and vaporization. And the excimer razor, we call it the photoablation effect. So we can use it like a knife or a scalpel, and then for the incision and excision and ablation. And sometimes it's used in eyesight surgery. And the last one in surgical razors is PDT. The full name is the photodynamic therapy, and some said call it a photo or chemotherapy. So we use photosensitizer to treat cancer like glioma or acne. And then the other part of the medical razor is non-surgical razors. We divided the therapeutic razor and razor acupuncture. The therapeutic razor, sometimes we call it the low-level laser and LLLT. LLLT is very traditional name in this field. It's mainly less than 1,000 milliwatt, low power energy, and to treat the wound healing and burn, and the pain management. And the last one is the razor acupuncture. Professor Shikora of Padova University, he published a paper in 2009, and he said that razor acupuncture, he defined that the razor acupuncture, low-level biostimulation effect of low-level laser plus acupoint specific acupuncture effect, he said. So we summarized that the effect of low-level lasers. The first one is that the pain elevation and anti-inflammatory effect, anti-edemic effect, and then inhibition of scar tissue by surgery and burn, and nerve function activation, cell activity acceleration, and cell regeneration and wound healing. So nowadays, many researchers and the experts prefer use that photobiomodulation than low-level laser or LLLT. So the photobiomodulation or PBM is preferred nowadays. In specific in Korean medicine, many Korean doctors usually the razor acupuncture, and in addition to pain or ENT area. So it means that laser can elevate the nose inflammation or ear inflammation or pain and brain disorder and dermatology. 980. What it means? It means that you can search razor acupuncture in PubMed. You can find 980 papers. Who did the researches? If you can find the razor acupuncture in PubMed, you can find almost 1,000 papers. But actually in South Korea and Japan and China, most people prefer the needle acupuncture. They understand that to treat their problem, they have to endure the pain, needling pain. But in this case, in the other situation, reverse situation in Western society, that's why many papers related to laser acupuncture published in Western society, better than, much more larger than in East Asian country. Today I tried to summarize some current trend of clinical applications of PBM. I divided in 4 parts: the musculo-skeletal indication, and stem cell differentiation, and skin regeneration and rejuvenation, and neurologic indications. Actually, almost 80% of the laser acupuncture or laser therapy, the indication is the musculo-skeletal indications. Let's check the paper. The paper is that, can you see that the low-level laser therapy in the management of neck pain, it published in Lancet. You know that Lancet is one of the top 3 general medical journals. So the impact factor is the 98 point. The top is the New England Journal of Medicine, around 70 point, and the next one is that the JAMA. And in this paper, the Roberta Cho summarized that the effect of low-level laser. Okay, yeah, let's check the first plot. So, as you can see, the parameter is a global improvement, and then the effect, the efficacy of low-level laser in laser group showed that the efficacy better than the control, placebo control. And next, yes, there's another figures. The parameter is then the visual analog scale VAS, and then it shows that the efficacy of laser therapy, the efficacy show the low-level laser than the placebo control. Okay, I'd like to, yeah, this is the stem cell differentiation. This area very difficult to find. I cannot see the presentation. Okay, 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 much better. And then this is the Pravin Arani. He tried to irradiate the low-level laser, and then it activates endogenous growth factor beta 1, directs dental stem cell differentiation. This picture showed that low-level laser induced territory dentine in a rodent model, and he showed that after the injury, this is a dentine, the teeth of the rodent, and then he showed that the stem cell regeneration, and then the low-level laser treated to generate ROS in mammal cell in vitro. Okay. I tried to skip the skin regeneration. Actually, it's a very, very big issue at this time. So, but generally, all of low-level laser, it has the same, same value of impact. The laser, aesthetic care and wrinkle care and hair growth. Okay, yeah, it's not the new series of Iron Man. many of them knew already, but it's the LED mask. It's very popular here in Korea nowadays. It's related with the near-infrared light related with the laser. Actually, the LED is not laser, but the same effect of laser, and then hair growth. This paper is that onychomycosis. So we called it fungal infection in fingernail or the toenail. and then there are some papers related to that. Actually, the laser is not the carbon dioxide laser, but we understand that the carbon dioxide laser has the biostimulation effect. So we understand that CO2 laser is the effect is included in low-level laser, photobiomodulation. And this is the neurology indications. I published the paper. This is actually in early ischemic stroke situation. Generally, the TPA is a kind of thrombolytic agent. It's regarding as the golden standard, less than 3 hours from the initiation. But in some case, because of some contraindication, we cannot use the TPA. In that case, they enroll the patient, and then they divided the two groups using the low-level laser to the brain irradiation. So after the initiation, the 30 days, 60 days, and 90 days, the NIH stroke scale, which differentiates the active group than the control group. It's published in Stroke. And the other indication is the neurodegenerative disease, Parkinsons disease. Some celebrate and leaders of our society with Parkinson's disease. And what is Parkinson's disease? It's defined that the TRAP symptoms. TRAP means the tremor, especially resting tremor, and rigidity, and akinesia, and posture instability. And the pathology is based on the degeneration of dopaminergic neurons on the substantia nigra of midbrain. And then we found that the PD, the mechanism of PD is based on the mitochondrial dysfunction, and then low-level laser can help it. Maybe the next speaker, Dr. Yang Chang-sop, he showed that the basic mechanism related with that. So I'll skip here. And some papers with the PBM for Parkinson's disease. Yeah, I published a brief review of Parkinson's disease with phototherapy. Actually, I won a prize in 2014, World Association of Radiotherapy and the North American Association at the joint conference at Washington, D.C., related with that issue. Okay, yeah. This paper is by the show, and then this is the MPTP injection. MPTP means it's a kind of a neurotoxin. So we inject the MPTP intraperitoneal cavity. It destroys the neural cell in the animal's brain. So let's focus the ENG, that magnified picture. So this picture showed that just the injection of after MPTP, it destroyed all neural cells. So many neural cells disappeared, and then this picture shows that just the injection MPTP and after then 15 minutes after then irradiate LED 670 nanometers. Then the main neural cells still survive. What it means? It means that low-level laser and near-infrared light has the neuroprotection effect. This paper showed it's very, very interesting, very unique method. This is the mouse brain, and then there's the optic fiber. They insert the optic fiber in the lateral ventricle. Lateral ventricle means that the water channel of the brain, and then it's lined with the battery. So you can see that this mouse is still alive. So it's crawling around the cage and eating something and drinking water without any problem. Very interesting and very fascinating idea. But I thought if you imagine the razor-eyed mouse around you in the midnight, it must be scared and very weird. I think so. Yeah, it must be the Terminator mouse. And then the result is that let's focus to the picture D, E, F. D means that just to only inject the MPTP. Without, there are many neural cells destroyed. And then this picture, I'm not sure, it's around 90 seconds 4 times. Picture E. And then the picture F means that 32 hours, continuous 32 hours radiation. But actually the 32 hours and 90 seconds 4 times, it looks very same. But anyway, they have the same neuroprotection effect. My final presentation. And then there is another study with the Johnstown. He irradiated the head of the mouse. And then he rubbed with foil the head, and then out of the irradiation is whole body. And let's focus the 50 milligram dose of MPTP. Yeah, whole body irradiation has the neuroprotection effect. Not that much, as much as the head irradiation, but whole body irradiation has the effect, neuroprotection effect. Okay, so I summarized my take-home message. Laser acupuncture and laser therapy have common areas, I think so. And in recent years, the scope of laser therapy has become wider and used to various indications. And then I think my final conclusion that traditional medicine also needs to develop technology through the introduction of new medical devices like laser. Thank you.